Welcome to the latest edition of the PetSmag podcast. Today, I'm delighted to speak to Professor Daniel Brockman, who is Professor in Small Animal Surgery at the Royal Veterinary College. And he's also a bit of a pioneer in the repair of mitral valve disease. Welcome, Professor Brockman.
Thank you. Lovely to be here.
Lovely to meet you. Can I just start by asking if you just tell us a little bit about your specialism, what you do, and the headlines of the key breakthroughs that you've had recently in the field of mitral valve repair?
I'm a trained general surgical specialist. I've been qualified since 1987, and all but a year and a half of that time has been pursuing surgery as a specialty. I became interested in heart disease in the 90s when I was working at the University of Pennsylvania, and we wanted to try and find a better treatment for dogs with mitral valve disease in particular, because it's such a devastating disease. And in humans, the treatment for valvular heart disease is surgical rather than medical. It turned out that was quite a big undertaking. It's not a trivial thing to develop the technique and expertise to do open heart surgery in dogs, let alone do complicated surgery like mitral valve repair. But we started that in 1995. I moved back to the UK in 2000 and have been working at the Royal Veterinary College since that time. But we weren't quite ready to embark on open heart surgery when I first returned to the UK. And it was about 2005 we started to develop a new program here at the Royal Veterinary College. We focused mostly on non-mitral valve cardiac conditions for the simple reason that my experience at the University of Pennsylvania had been that mitral valve disease was an incredibly challenging thing to treat surgically, mostly because it affects very small, medium-sized dogs. They're often middle-aged when they get the disease severely enough to
So can
warrant
you
an
tell us a
intervention.
little bit about the breeds that are affected? I mean, as
The
a
most, the most
Cavalier King
common,
Charles
yeah. So
Spaniel owner, I know that they are very affected by it. Sort of the prevalence is something like, is it, correct me if I'm wrong, but 80% by the time they're age 8 and above.
I think
Is correct?
that's pretty accurate. But the two
Mm,
breeds that we see most commonly are the Cavalier, in this
mm,
country, the Cavalier and Chihuahua.
mhm, mm.
And of course, there's quite a big size difference between those. But you're right, Cavaliers are particularly smitten by this disease. Not all of them will have disease that progresses to such an extent that a surgical intervention is warranted. But sadly, we do see some dogs, Cavaliers, as young as 5 years of age, that have had a bout of heart failure. And once heart failure has developed, the statistic is that most dogs will succumb to the heart disease within 12 months of the onset of failure or the diagnosis of failure. So that's a 5-year-old dog that might die by the time it's
It's
7, if
just,
it's lucky.
it's absolutely heartbreaking. You can see, I have Cavaliers in the background, two of whom have mitral valve disease. But they're such a sweet and amazing breed that many people still, well, they're still a very, very popular dog, and they're a victim of their own popularity, though, aren't they? Because this disease, this condition has come about because of the small, incredibly small gene pool, which is why this is so prevalent in Cavaliers. Is that
I,
correct? Would you say?
I think it's fair to say that we don't truly understand every aspect of this disease, but clearly, because there are such
Mhm,
stark breed predispositions, and something has happened,
mhm,
as you mentioned, in the the selective breeding process that led to the development of these breeds. And we see it sadly in all pure breed dogs to some extent, but Cavaliers are unfortunately clearly profoundly affected by whatever encodes this particular disease and some other connective tissue disorders as well. And
Mhm.
obviously, the long goal is to try and establish exactly what the defect, the genetic defect, or the encoding gene actually is, and either neutralize it somehow. But the short-term consequence of this is that we are faced with a lot of Cavaliers
Mm.
with in this particular context of this discussion with heart disease, and they are severely debilitated, and it's a real welfare problem for them and their owners too.
So certain countries have, I believe, banned the breeding of Cavaliers, for instance, because of their predisposition to this condition. Without going to, adopting such an extreme measure, how can we as a society, combat this, whether it's, more responsible breeding practices, more regulation, if you will, before we get to something like gene therapy being more prevalent.
Yeah, well, of course, that's such an enormous question, and
Mhm,
I'm a trained surgeon, not a geneticist,
mhm,
so I'm not really well equipped to
mhm,
answer that in
mhm,
any
mhm,
specific way. But until we properly understand the disease, it's going to be very difficult to know how to either screen or select appropriate dogs for breeding. And
mhm,
if you want to get rid of a condition, you need to know, you need to find what it is that's
mhm,
causing that condition within a population and work towards
mhm,
neutralizing it somehow. But
mhm, mhm,
sadly, it's similar to the story with hip dysplasia, elbow dysplasia.
mhm,
There
mhm,
are some more obvious conditions like brachycephalic conditions
mhm.
that are we can
French bulldogs, for instance.
exactly we can see that there's a conformational thing, and if we get rid
Mhm,
of that
mhm,
genetic conformation type, then we will make progress. It's not so clear with mitral valve
mhm.
disease, and there are so many other dogs that are affected. It's just that the Cavaliers are very severely affected.
Yeah. Okay. Right. So, if you have an asymptomatic dog with MVD, as I do in two cases, how do you begin to weigh up whether surgery is a viable future option, and when would be the ideal time to intervene in that?
That's a great question, and obviously for owners of breeds of dog that are at risk, you as a Cavalier owner will be
Hmm.
very sensitive and aware of the need to monitor and track your dog's heart health.
Hmm.
Sadly, for a lot of owners that don't are not quite so familiar with this disease, it can come as a bit of a shock. And the first thing they know about the disease diagnosis is the first bout of heart failure. But if you are, as it sounds as though you are, monitoring your dogs fairly closely, then what we would recommend, because it's hard to improve on a dog that's not showing any clinical signs. So there is risk associated with a surgery, and the risk varies from center to center, but there's only three active centers in the world, in the English-speaking world,
Hmm.
that do this surgery. And so it's a big undertaking. But my philosophy is that the ideal candidate really is a dog that's had a bout of heart failure, but has been
Hmm.
rescued out of heart failure with
Hmm.
appropriate medical treatment,
Hmm.
um, and and then schedule surgery at that time. Now, it's such a challenge to actually predict how rapidly this disease is going to progress in any individual dog. But most dogs you would expect to have between 4 and 6 months from the onset of failure to organize a surgery. And I think
Mhm.
from our perspective, the ideal candidate is what we call an early stage C dog using the ACVIM classification. That is a dog that's had a bout of heart failure, fluid buildup in the lungs, and has started taking what is normally furosemide, a diuretic treatment
Mhm.
for that, along with the other drug treatments that are useful. And
Vet
pimabendan would be
med,
the vetmedin would be
yeah.
the obvious one. Um, in Japan, where they have performed a great many more surgeries than we have, or the center in Florida, they are much happier to operate on what they call advanced B2 dogs. So that's dogs that have got a leaky valve. The leak is so bad that it's made the heart remodel and get bigger to accommodate the leak.
Mhm.
But they haven't had a bout of heart failure. And there are things that you can look at on an ultrasound scan in particular that give you an indication of how close that dog might be to a bout of heart failure. And for the Japanese team who have um,
What
uh,
sort
uh,
of things would you look at in
uh,
layman's terms?
well, just if I could just backtrack one sec, that
Yes.
if the risk associated with surgery in Japan is
Mhm.
between a 95 to 98% chance of getting through the surgery, that's a lot less risk than unfortunately would be the case if you came to our clinic.
Mhm. Mhm.
So from an owner's point of view, um, if you have an asymptomatic dog that you know has got a heart murmur, and let's say your vet or cardiologist has deemed it appropriate to start giving pimabendan or vetmedin treatment of some sort, then the single most useful thing you as an owner can do is monitor the resting respiratory rate.
Mhm.
That's
Mhm.
quite a challenge sometimes because what you really want is a dog that's, well, like the two I see in the background, resting very comfortably, not excited at all. Now would be a good time to measure their respiratory rate, the number of times their chest goes in and out in a
Mhm.
minute. And what we're after is some sense of tracking that over time. And if that respiratory rate is creeping, normal dogs will be between 14 and 20, something like that.
Mhm.
If it starts to creep up towards 30 on a consistent basis, then that would be a good predictor of the potential onset of failure. So as an owner, that's the single most useful thing you can do. But of course, there are other indicators, willingness to exercise, interest in food,
Mhm.
interest in the environment,
Mhm. Mhm.
and most owners are uniquely and incredibly sensitive to changes in sort of, for want of a better term, personality as well.
Okay, so if we got one gets to that stage where there's you know they start to become less asymptomatic, they show symptoms, their heart rate increases, resting heart rate increases. You've got you know a couple of options, assuming that you know first of all vetmedin, then fusamide, or to make the decision to um, you know, put your dog in for surgery. That those
Well,
are
yeah,
the options at the moment.
They are. So
Hmm.
the treatment options are either escalating medical treatments
Hmm.
under the guidance of ideally under the
Hmm.
guidance of a trained veterinary cardiologist. And just again to point out that I am not a cardiologist, so
Hmm.
I'm a cardiac surgeon. But yes, the other option, if you if your cardiologist feels that your dog's heart condition is progressing even pre-failure, but is progressing, then that's the time to think about surgery. And as I've mentioned previously, I mean, it's not a trivial undertaking.
Mm.
There is risk involved. It's expensive both in terms of finance and emotional investment. So it's something that you would be wise to think about beforehand, rather than having to make a very
Mm.
difficult decision under very challenging emotional circumstances.
You mentioned Japan. In the UK, how many roughly cases have you tackled? Um,
We've done close to 300 mitral valve repair
mhm,
surgeries,
mhm.
and total open heart surgical patients would be closer to 350. But the other conditions that we can treat surgically are a lot less common than mitral valve disease.
Okay. And in terms of accessibility, how realistic is that mitral valve repair becomes more widely available and possibly even covered by pet insurance in the future?
Well, at my centre, or not my centre, at the centre at the Royal Veterinary College, we are actively training additional surgeons as and other members of the team. So we really hope that, let's say, in 5 years' time, there will be several centres in the UK that can offer this treatment, and um, I'd hope that will make the surgery available to more folks. I know the team in Japan has expanded so that there are two surgeons now doing the procedure, and two different teams managing the patients. And Florida have a similar philosophy. They want to train more people to do it.
Mhm.
Of course, the accessibility is not just in terms of how many people can offer the surgery, but as I mentioned previously, it's very uh, expensive to do, and
Roughly how much ballpark?
well, our current fee is 24,200. That will increase on an annual basis in accordance with
Mhm.
normal inflationary increases in our price structure. And the reason it is that much is because all of the disposables that we use, the equipment that we use, is the same equipment that would be used in a human hospital
And of
doing
course, there's
heart
no
surgery.
NHS for animals.
And sadly, there is no social medicine for animals. And so
Mm.
the equipment that we use, the materials that we use, and the manpower that's required
Mhm.
is substantial. I'd love to make it cheaper,
Mhm.
but it's very difficult to see how anyone could do that. And we're not trying to make a lot of money out of this. We just want it to
Mm.
be not costing us money. And even with that philosophy, it's expensive.
Okay, thank you. So, Professor Brockman, can you talk about a lot about multidisciplinary teamwork? Can you walk us through what a day in the life of a surgical case looks like, a typical surgical case?
Well, yeah. So obviously, before we've talked about how we decide a patient or a dog is going to be a candidate, and that requires already the input of cardiology specialists as well as the surgery team. But on the day, um, we need specialist anesthesiology or anesthetists to administer anesthetics to what are arguably some of the most fragile dogs that we have to anesthetize. The surgery team, once the patient is anesthetized and ready to go into the operating room or operating theatre, the surgery team usually consists of two fully qualified surgeons and one or two highly trained surgical technicians or scrub nurses, as well as circulating nurses in the operating room and someone to run the heart-lung machine to keep the dog alive while we are safely opening the heart, stopping the heart, opening the heart, and
Mhm.
performing the intra-cardiac manipulations. And finally, the cardiologists are in on the action again because they use a special ultrasound or echo probe during a procedure that goes down the food pipe, and we can look at the heart before and after the repair to make sure that the repair is sound and that the heart is at least recovering initially uneventfully. From there, once we've performed the surgery and recovered them from cardiopulmonary bypass, they need to recover from the surgical procedure proper, and that's when they get transferred into the care of our intensive care unit and the critical care management team.
And how long
Um,
does that recovery process take?
so the surgical procedure is usually around about 3 hours. So
Mm,
if we start operating at 9 o'clock in the morning, by midday we should be in a position to move over to intensive care.
mm,
They spend then 2.5 days in intensive care usually.
mm, mm,
And there's very, very intensive monitoring to start with, and that's slowly downgraded as we can become more and more comfortable
mm,
with the progress and making sure that the dogs are comfortable in terms of pain relief.
mm,
We monitor their blood work daily, and we will perform echocardiographic assessments alternate days usually, but every day if there are any concerns. And that period of hospitalization lasts about 7 days. So they spend usually about 3 days in intensive care and then another 4 days in our hospital
mm,
being closely monitored while they recover. But most dogs will be discharged from the procedure in between 7 and 10 days after
mm.
surgery.
And is it a period of months before, they can resume normal activity or even improved activity levels?
Yeah, so we are inserting stitches inside the heart, and
Mm,
those stitches have got to get sort of incorporated into the tissues to be strong enough to withstand
mm,
typical daily activities. So that process probably takes between 4 and 8 weeks. But what
mm,
we ask owners to do is keep their dogs fairly strictly exercise restricted for 3 months.
mm, mm,
During that 3 months, the dogs are taking medications that will reduce the risk of blood clots forming on the stitches that are inside the heart.
mm,
And a good old aspirin and a drug called clopidogrel or Plavix is what we typically use for that.
mm,
Um, Once we get beyond 3 months, then if we see on the echocardiogram that the repair is stable, the leakage in the valve is hopefully either zero or just trivial, then we would allow owners to start to um, allow their dog to behave more normal in terms of exercise, gradual reintroduction of off-lead exercise,
mm,
and
mm.
then active playing or whatever they normally do. And so the short-term pain for long-term gain, I think, is the
Okay.
term.
And what are the long-term outcomes of the surgery? So is it return, or return to health?
Well, would certainly,
Many more years of lifespan.
yeah, certainly return to normal cardiac health, we would
Mm,
expect. Um, some dogs that have very advanced disease, their
mm, mm,
heart can't actually recover and remodel as effectively as either some of the younger dogs or
mm, mm,
some of the dogs with less severe disease. But most dogs, if we can get the amount of blood leaking through the valve down to a level that is trivial,
mm,
then
mm,
their heart will remodel and they will live a normal cardiovascular life.
mm,
Um, I sometimes say to clients that from our perspective, successful treatment will be for their dog to live long enough to die of a non-heart related condition.
Mhm.
And I think that that's, I mean, it sounds a little bit flippant, but that's what we hope. We can't predict the future in terms of other disease
Mhm.
processes, but we have had dogs that some of the early dogs we operated on in 2017, 18, are still trundling around. So the long-term outlook for most dogs is dictated by other disease processes. And
Mhm.
if they're lucky enough to stay free of other diseases,
Mhm.
then the repair seems to be very durable.
Okay. Thank you, Professor Brockman. If viewers are interested in finding out more, where would they go? Go to the RVC website?
There's a lot of good information on the Royal Veterinary College website. You have to dig around a little bit in the
Mhm.
clinical services and look for heart cardiology and heart surgery, but we've put some nice information on there for anyone who's thinking about this as a treatment for their dog.
Okay, brilliant. Thank you. Well, it's remarkable work you do, and I just wanted to say what a fantastic guest you've been, particularly something so, to use a pun, so close to my own heart. Thank you, Professor Brockman.
You're very welcome, and I hope you take this in the right way, but I hope I never meet you in the consulting room.
Me too. I agree wholeheartedly.